The United Nations Children's Fund, UNICEF, has donated health and sanitary kits to internally displaced persons camped at the international market Makurdi to address their immediate health needs and prevent diseases. Items donated included 300 units of cholera kits such as laundry, detergent, water guards, kettles, buckets, jerrycans, and multipurpose soaps. Others are water purification tablets, HTH chlorine for water treatment, pool testers for water quality, among other health commodities for the outreach. Presenting the items, UNICEF Chief Field Officer Dr. Kerida Burikuli said the donation became imperative due to the vulnerability of the IDPs, especially the newborn babies and nursing mothers. She explained that UNICEF has a clear mandate to address the needs of children and women affected by humanitarian crises, including internally displaced people. Dr. Birukila said UNICEF was working closely with other partners to provide relief items to IDPs as a significant part of the organization's responsibility to deliver essential supplies, including water, sanitation, and hygiene items to ease the sufferings of the displaced population.
The government commissioner, the cholera kits, that includes things for hygiene, and also we have given some medicine, water treatment, among other things, because in this kind of environment, it's very important that we take care of water and sanitation, and also for cholera kits that will have things that can protect the population. We see there are a lot of new mothers around and babies. So we are also providing healthcare, including immunization, treatment. We are working very closely with the other partners like Nigeria Red Cross. We are working with also IOM and the UNHCR to ensure that, and also with the government as well, to ensure that we ease the suffering of the displaced people.
Also speaking, a health specialist with UNICEF, Dr. Ifeyinwa Anyanyo, observed that UNICEF has been on ground supporting 10 out of the 15 registered IDP camps with mid- and long-term recovery plans to reintegrate them back to their ancestral homes, noting that partners were committed to working with state agencies to mitigate the impact of the crisis.
And like I said, it's a cross-sectoral response. You have the WASH colleagues, you have the child protection, you have the nutrition, education. So it's a holistic support to the state.
Receiving the donations, the Benue State Commissioner for Health and Human Services, Dr. Yama Otese, commended UNICEF for its intervention and donation, especially the cholera kits to the IDPs.
What they have brought here, they brought kits to sanitize water, also antibiotics that will help us in issues like diarrhea diseases, anti-malaria for malaria. So it's quite a welcome development. We share them on behalf of His Excellency, the Executive Governor of Benue State, for this gesture. We believe that it will help us to combat so many preventable diseases.
Dr. Otese said items will support the government's efforts, stressing that the ongoing efforts by UNICEF to support vulnerable populations, particularly women and children during emergencies, was vital in keeping them safe from some of the health complications while in the camp.